mistake. Do not bend down for anything, for anyone. Do not bend at the waist when you're stretching. Do not bend at the waist when you're picking things up. And do not bend the waist when you're in yoga class. Do not bend down when you're in Pilates. Do not bend down when you're weightlifting. Always protect your back. It is smart to protect your lower back, and do not run the risk of bending down anytime ever. The only time you'll see me bending down like that is when I'm showing people what not to do. Just because it doesn't hurt right now doesn't mean that I'm not causing a problem. So I want to make that point very clear. There are other pelvic bridge maneuvers that I'm a big fan of, where you lie down and you lift both hips up and you pump going this way. So you do kind of a Kegel, and you're pumping, you're working the hydraulics of your lower back. So you're lying flat on your back, bending your knees with your feet flat, 15 or 20 reps. Okay, we're going to look at that. We're also going to look at what to do when you're in the seated position. Okay, so next we're looking at the lumbar bridge maneuver. Now there are about a dozen different maneuvers that I teach, but I'm going to show you, for the sake of simplicity, just a couple of simple maneuvers to be done at home. I'm going to show you the lumbar bridge, 15 to 25 reps, a few times a day, up and down. Breathe. Breathe when you do this. Doesn't matter exactly how many you do, as long as you pump. The idea is to work the hydraulics of your lumbar spine. Remember to breathe. Get into a rhythm. Also, this kind of helps even out the base of your spine, your pelvis, your tailbone. So I like to keep things very, very simple. 15 to 20 repetitions, done several times a day. Pelvic bridge maneuver. Next, I'm going to show you the 3-pump. Okay, so what is a 3-pump? This is just a little maneuver that I've developed that I never have seen anybody else teach. Back when I hurt my back, my understanding of the disc switched from being purely academic to very personal. I tried lifting a heavy plow one time. We were in the country, and I had a neighbor in the country who was giving us his plow. He was moving away, and he said, "Here you go, thanks for letting us use your tractor, bye." And there was a plow sitting there in the middle of the field. Well, I had my cutter attached to my tractor, and the cutter is quite difficult to unattach. There's a hydraulic mechanism, all these different pins and bolts. But I got the bright idea, well, instead of unattaching it and pulling the tractor around and attaching the plow to move it over to the barn, how about if I just pull the tractor around, and I pulled my tractor with the cutter still on it. It's a big flat cutter. And I thought, I'll just pull it next to the plow, and I'll just get the plow onto the cutter. Not smart. Okay, I learned a very valuable lesson here. So I drove my tractor around, pulled it up next to the plow. I got under the plow, used great technique. Now this is a case where even good technique will not save you from back injury. And I got into this thing, and I went, and I used my legs, and I got that plow onto the cutter. I thought, oh, I didn't feel anything right away. But the next day, when I woke up, I jumped out of bed, my legs collapsed, and I fell on the floor, chin on the floor, with pain shooting here all the way down to my foot. I was in agony, and I thought, great, I just herniated or blew out a disc. So I went and had an MRI, and it was a sizable bulging protrusion, but it was still contained, and I was disabled for about 6 weeks. And I began, all of my understanding of the disc went from being purely academic to personal. And when it's personal, it becomes a passion, especially when I'm in the business. I'm in the business of dealing with spines, and here I go hurt my own back. So I became a fanatic, so to speak. I became very vigilant about ways of keeping the spine from breaking down, and I became very thorough in my understanding of the disc. I began doing a lot of other training, conferences, seminars, workshops, observing surgeries, just everything I could do, learning about MRI scans to learn how to teach other people not to let this happen to them. I also learned the very best ways to help rehabilitate a herniated disc or a weak disc, and I learned And it really seared into my understanding about the micro tears and how this happens over time. And I kind of looked at this as a blessing because now I'm purely empathetic when someone's in a tremendous amount of back pain, and I'm very much a stickler about the details and when I see somebody in pain and they come into my office and I realize if I could have connected with them a few years before, or 5 years before, or 10 years before, I might have been able to help them change their course. And it's really sad when people come in and they're crying and they're in back pain, or they're disabled, or they're impaired. That's not good. So this is a passion of mine. So the lumbar 3-pump. What is the lumbar 3-pump? Remember, there should be a natural arch to the lower spine. What you're going to do is you're going to draw an imaginary line from your front belt buckle to your back belt loop. So if you can imagine a straight line and try to focus just on that line. People get all confused. They're doing all kinds of things. Focus on that, because if you focus on that, everything else will follow. The 3-pump would look something like this. You're going to move that line horizontally back and forth anytime you're in the seated position. Now this can be done on your back, but especially when you're in seated position. So it would look like this. 1, 2, 3. And then on number 3, you kind of hold the forward position. You don't hold your breath, you hold the forward position. The reason this is important, I've discovered that if you do a small maneuver throughout your day, it works much better than doing some awesome stretch in the morning and then not thinking about it the rest of the day. So this is something that's designed to work the hydraulics of your spine. It's designed to remind you to end up with your foundational bone called the sacrum slightly forward. I'm going to show you what I mean. The sacrum is your foundation, your true foundation to your spine. It's the lowest bone at the very base, and your L5 vertebrae stacks on top of the sacrum. And the angle of this bone determines the shearing force and the weight-bearing load. So when we move our foundation forward, that alters the angle of the position between the lowest bone and your foundational bone. Now let's see what happens when we slump. Let's say I go all the way down and slump down like that. If I have a herniated disc that's bulging toward the back, think of it like a jelly donut. If it's weak toward the back and I lean down, it squeezes the disc into its weakness, makes it much worse. Compared to if I bring that bone forward, it alters the weight-bearing load on the disc in such a way that allows your L5 bone and L4 to assume a different angle, more like this. Okay, so follow my fist. Think of this as the sacrum or the foundational bone. Think of this as your L5. When we slump, it does this. The sacrum goes back. The base of the sacrum goes back, and the disc goes into its weakness, like that. However, when we bring it forward, it brings the sacral base forward and brings that L5 bone into a healthier stack. So you're getting two benefits. When you pump, you're pumping the hydraulics of your spine, which helps get nutrients into the core of the spine, and you're working the hydraulics to help get circulation into the area. Plus you're breathing as you do this. Plus you're ending up with your foundation slightly forward rather than back. Now this is a habit thing, and people forget. I'll be doing therapy on them, and a week or two later I say, how's the 3-pump going? They'll say, the what? And they've completely forgotten everything that I've taught them. So the 3-pump is designed, and you'll hear me remind you about this a lot. 3-pump is designed to be done throughout the day. When's the best time? Well, how about when you pull up to a red light? Use that as your mental anchor. When you pull up to a red light, think red, pain. Okay, so that's when you can do your 3-pump. Most stoplights are going to be at least 30 seconds long. So you're going to do a 3-pump, you pull up to a red light, hands on the steering wheel, and it would look like this. 1, 2, 3. And on 3, you're going to hold it forward rather than back. Okay.